Dr. Johnston and the team he works with, from the nurses and techs to the OR purchasing manager, want the best for their patients. When Dr. Johnston performed his AV access and bypass procedures with EPTFE, his patients weren't achieving the outcomes he wanted, particularly around thrombus formation and patency rates. That's when his LeMaitre rep, Trey, introduced him to the Artegraft collagen vascular graft for functional hemodialysis and lower extremity bypass. But he still had questions about Artegraft. How does it stack up against the performance of synthetic grafts? Trey tells Dr. Johnston that Artegraft is a proven technology with over 500,000 implantations. As a bovine carotid artery graft that's been processed to enhance long-term patency and provide a flexible, cross-linked conduit, it outperformed EPTFE in clinical studies. Studies have demonstrated that Artegraft reduced thrombus formation compared to EPTFE, and it has clinically proven long-term durability and secondary patency rates. In fact, in lower extremity bypass, the 5-year patency rates with distal anastomosis was 88.4% for above-knee popliteal arteries and 86.2% for limb salvage. Dr. Johnston agrees to try Artegraft for a few patients and is impressed. He experienced Artegraft's easy surgical handling, and because the strong collagen matrix retains the original artery crossweave, straightforward suturability for himself. And with multiple sizes available, he can find grafts that match his patient's host vessel. It's not surprising. After all, LeMaitre was founded by a vascular surgeon, and they focus all their efforts on creating the best possible portfolio of vascular products. When Dr. Johnston requests that Wendy, the OR purchasing manager, acquire Artegraft for his future procedures, she's focused on cost. How does it compare? For AV access, Artegraft has lower graft infection rates compared to EPTFE and is naturally biocompatible and non-antigenic. With fewer interventions, it aids patient outcomes while reducing overall healthcare costs. In lower extremity applications, Artegraft offers reduced risk of graft infection and excellent long-term patency outcomes. The 5-year overall primary patency rate is 66.7% and 74.6% for secondary patency. So, it's good for patients, and the hospital is saving money in the long term. Consult your LeMaitre sales representative or visit the LeMaitre website to see how the Artegraft collagen vascular graft can aid your patient outcomes while reducing healthcare costs.